Do you suffer from low back pain and need lasting relief? Do you have persistent pain in your back, hips, or legs, including sciatica? Do you think you've tried everything but don't want surgery? If you answered yes to any of these questions, this program is for you. Welcome and thank you for watching. In the next few minutes, we'll take a look at what causes back, hip, and leg pain and how our clinics can help. You'll learn how your back works and why our treatment programs are so effective and why other treatments like traction and surgery aren't. So if you or someone you know has back, hip, or leg pain and needs relief without the risk, recuperation, and expensive surgery, please keep watching.
I was using a cane for a few days, and then I had to switch to crutches because I could not walk on my own without pain in my leg. And it was just excruciating pain to the point that no matter whether I sat down, whether I lied down, whether I stood up, anything, it was just pain, constant pain.
My back had gotten really bad. I got where I couldn't walk. I was spending a lot of time in bed because I just couldn't walk. I had a lot of pain.
I was in terrible pain. I was crawling on the floor, and I had gone to a couple of back doctors, and they were all suggesting that really the only solution was surgery.
The pain was indescribable. Terrible pain, couldn't sleep. You know, I wasn't getting rest, and this went on for 3 months.
I spent 5 weeks flat out on my back. I mean, I literally couldn't walk, I couldn't sit in a chair for more than 10 minutes, and it was awful.
I crushed L1 to L5, but they had not ruptured. But they were very close together, so any lateral movement made them pinch nerves.
We begin with back pain, the number 2 most cited reason people visit a doctor, second only to the common cold. If your back hurts, you're not alone. In fact, you're one of over 31 million Americans who suffer from back pain. Like many others, you may have tried conventional treatments, including rest, massage therapies, muscle relaxants, or heat and ice. The bad news is that when these treatments fail, you may think you're left with the pain and no choice but surgery. The good news is that there is another choice, and it's safe, effective, and requires no hospital stay, no anesthesia, and no incisions. It's called VAX-D, and in a moment, you'll see how this revolutionary treatment can relieve your pain and help your back to heal without the risk associated with surgery.
I can walk, which is a big thing. I can sit down without any pain. I can lie down without any pain. I can resume normal activities, you know, hiking and walking and just the things that we take for granted.
I am pain-free. I can walk. People at work stop me now and they look at me and they say, hey, you know, what's happened to you? Suddenly I can almost run down the hallways. I'm just in no pain at all. It's just amazing.
I'm amazed. I mean, from the amount of pain I had and the stuff that was going on to the point that I'm at now, I'm just amazed. I mean, that's why I agreed to do this because, you know, usually you see these kind of commercials, you see people doing endorsements, you think, well, what's their motivation? You know, this was truly a good product, and I'm always for supporting something that works, and it works.
I was always a little bit nervous, you know, that I'm going to stumble, I'm going to trip, I'm going to turn, I'm going to bend some way that's going to aggravate it and it's going to start again. And it never happened. It was just gone. It never happened. And now 3 years later, it still has never happened. So it's wonderful.
It's been like a miracle, it really has. It really has. You know, I didn't think I'd ever be able to walk again without limping and, you know, all that stuff. So it's been wonderful.
Gave me my life back and allowed me to continue in a forward direction instead of going sideways or backwards, or even stopping. Life for me is for the experiencing and the living and the doing. And as I said before, there's a whole gigantic world out there. I've seen a good bit of it. There's more I want to do.
First, it's important to understand the structure of your back and spine, how it functions when it's healthy, and what happens when injury occurs. Your spine is made up of vertebrae, small bones stacked one on top of another to form a column, protecting your spinal cord. Between each vertebra is a disc that acts as a cushion, keeping the bones separated and allowing nerves from your spinal cord to branch out into the rest of the body. Even in a healthy spine, constant pressure is being applied to your discs, whether you're standing, lifting, or even lying down. When injury occurs, this pressure can inhibit the disc's ability to function properly, pinching nerves and causing the intense pain associated with back injuries. The majority of all back problems are related to the disc. Disc injury is often the result of a herniation or rupture. Imagine a tire. The pressurized air inside is held in place because of the tire treading, so it keeps its shape. But if the threads become weak or stress is put on the tire, the pressure inside causes a bump or bulge to occur. To remove the bulge, you need to decrease the pressure inside the tire by letting some air out or lifting the tire off the ground and fixing the tread on the tire. Your disc works much the same way. When stress is put on your disc, it can cause the nucleus to bulge or break through its walls, pinching nerves and causing intense pain. If the bulge presses against certain nerves, it may even cause peripheral problems like sciatica. Sciatica is characterized by a tingling pain or numbness down one or both legs, caused by pinching of your sciatic nerve, located in your lower back. If left untreated, sciatica can worsen until it's difficult to stand or walk, and may even result in paralysis. But relieving back pain and healing a disc are difficult for several reasons. First, the disc does not have a network of blood vessels bringing oxygen and nutrients to it. It works instead by a pumping action. Whenever you move, whether walking or bending at the waist, your spine moves, pumping oxygen and nutrients into the disc. When the disc is injured, however, movement is painful, sometimes impossible. Without movement, oxygen and nutrients cannot reach the disc, so it cannot heal and over time may deteriorate. To heal the disc, oxygen and nutrients need to be restored and pressure on the disc removed. As you've learned, there is constant pressure on the disc, even when you're lying down. So how do you remove this pressure and restore the disc to its normal, healthy state? VAX-D therapy, also called spinal decompression. VAX-D was developed by Dr. Alan Dyer, former Deputy Health Minister of Ontario and the inventor of the heart defibrillator. Having suffered from back pain himself, Dr. Dyer studied the causes of low back pain and why current treatments weren't working. Rather than have surgery, Dr. Dyer dedicated himself to developing a safe and effective way to decompress the spine so the discs could heal naturally. The result? Vertebral axial decompression, or VAX-D. VAX-D therapy relieves back pain and helps your disc to heal by creating negative intradiscal pressure, like lifting a tire off the ground to remove a bulge. VAX-D reverses pressure on the disc, pulling the nucleus back in place and increasing oxygen and nutrient flow, allowing it to heal. With the nucleus in place, pressure on the nerves is also removed, thereby helping to relieve your pain. Patented and shown in multiple medical studies to be over 75% effective. VAX-D is a safe, non-surgical therapy that relieves low back pain. And because there are no incisions, no anesthesia, and no long recovery periods, you can receive treatment without missing work. VAX-D has been successfully used for years throughout the United States, Canada, Australia, Puerto Rico, and England for the treatment of low back pain associated with disc protrusions, degenerative disc disease, facet syndrome, and failed back surgeries. VAX-D therapy is performed in the office, each session lasting only 30 to 45 minutes. Many patients report improvement after just a few treatments. The treatment uses a patented computer-controlled split table design to gently decompress the spine. A specially designed harness is fitted to your pelvis, then you lie fully clothed on the VAX-D table. Under medical supervision, one of our professionally trained certified VAX-D therapists will start the treatment, monitoring the amount of pressure applied by the computer-controlled table.